Hi everyone, it's Dr. Hart here. Today we're gonna do something different from what we've been doing. Many of us have been exposed to shocking events that happen in the sports arena where young healthy individuals have cardiac arrest or cardiac events. So today we're going to review some of those cases and see what we can make out of them and what lessons we can learn as a community. Let's do it. Oh, that's really shocking there. That way, how unexpectedly he falls back down is the typical scenario that we call in medical terms syncope, which is that sudden loss of consciousness that will make someone fall that way that you just saw. That's usually a sign that either the heart rate or the blood pressure or the cardiac output, which is the amount of blood that is circulating in the body, is not sufficient to provide for, especially for the brain needs. So basically what the brain does is like any other electronic would do, which is when there is a low power input, it will just turn off and come back up on if there is enough power. If there is no power, obviously stay off. So that's what we're witnessing here. That player there probably had that situation where there is not enough blood flow to his brain, and that's why he essentially passed out. Now, after the initial shock of seeing someone collapsing that way, several things happened simultaneously there that we could learn from this incident. One point there is someone needs to stay calm. Yes, it's a very shocking event, but as you could see, the medics came in and did what they needed to do, which was initiate cardiopulmonary resuscitation, also known as CPR. And if there is a defibrillator available, then bring that defibrillator. If the heart rhythm is a shockable rhythm, the device itself will activate and do that for you. Professional athletes are thoroughly studied medically. They undergo extensive comprehensive physicals and testing before they engage in competition to make sure they don't have any significant heart disease to begin with. So it is unlikely, although still possible, I guess, that maybe there was an undetected problem on this player that nobody had picked up in his previous exams, but that seems to be less likely. The most likely event that happens here is that blood, if you can watch that clip on your own later on in a slow motion, you see how this player receives a blow into his chest by the other player, and that blow probably happened at a time where the electrical conduction system of the heart was prone to develop an irregular heart rhythm known as a ventricular tachycardia that degenerates into cardiac arrest, and usually that takes a few seconds to a couple of minutes. This is why the player gets up and then goes back down. Now, in the way to the hospital, paramedics are doing all they can to keep the patient alive, to keep pulse, to keep some degree of perfusion, meaning blood flow to the brain, to try to preserve the brain, which is the most sensitive organ to lack of oxygen and prevent a permanent damage. And in the hospital, obviously, with all the medical technology right now to provide life support, I'm sure they did, what's a standard, which is support the ventilation, support the circulation with medications and machines that will keep the patient alive to provide enough support for the body to heal itself and recover from the event. Yeah, that doesn't look good. That, right there, the total lack of response and the urgency of the teammates there, calling for help tells us that he's not really doing good. It really didn't look good from the get-go. The way he fell forward with not protecting himself from injury tells us that he really did have a totally unexpected event that did not allow him or allow his body to use those protective reflexes. When we fall, we usually put our hands to try to protect ourselves from any injuries to the face, and in his case, you could see in the clip there that didn't happen. So this one, there was no, at least what I can see in the clip, there was no previous blow to the chest by the ball or by another player. It looked like a very normal low intensity play, so less likely to be what we saw on the previous event, less likely to be commotio cordis. Commotio cordis is the medical term for what happened to the previous player when you get a big blow to the chest in the wrong timing of the cardiac electrical cycle. In this case, it looks a totally different situation. I can see the headline of this media report is that the player falls down because of a heart attack. Again, for a young, healthy, fit individual like this soccer player, it is highly unlikely that this is truly a heart attack. A heart attack in the way most of us understood. A sudden damage to the heart muscle caused by a blocked artery to the heart, or a sudden stoppage of the blood flow into the heart muscle that causes the heart muscle to die. That's what we traditionally understand as a heart attack. I'm not sure exactly what the reason for this event was. If I remember correctly, later on, this player was given an internal defibrillator, which tells me that he did have some sort of problem with the electrical conduction system of his heart, but definitely not a heart attack. Okay, this one looks interesting because again, looks very different from the previous two. I don't know the events preceding that moment when the player was bending forward and indicating that he didn't feel well, but it seems very different from the previous ones. In the previous ones, there was loss of consciousness, i.e. syncope, and in this case, there was no loss of consciousness. He just voluntarily lay down. That position that he adopts at the beginning, where he's bending his knees, bending forward his torso, and using his hands to sustain his body, bending forward on the knees, is something we call the tripod position. And that tripod position usually is the most comfortable position for someone that have sudden shortness of breath, because in that position the angle of the diaphragm is the best angle for easier expansion of the lungs, and typically that's what naturally, instinctively anyone would do when they feel shortness of breath. And then the player puts a hand in front of his chest. I don't know if you guys saw that, but usually that open hand in the chest or the fist on the chest is another medical sign that there is a significant cardiac event going on. If I remember correctly from the story of this player, further studies demonstrated that even though he's young and he was, physically fit, he did end up having a semi-blocked heart artery that was causing restriction to the blood flow into his heart muscle. So probably what he was having on the pitch was an episode of what we call angina. Angina is the medical term for the symptoms, be it pain, pressure, heaviness, tightness, discomfort, typically associated with shortness of breath, that occur in the setting of the heart muscle not receiving enough blood flow. Well, in this case, what we see here is what looks to be a middle-aged man who seems to be overweight and is working out in a gym and suddenly collapses. What this gentleman had there was a syncopal episode. Bystanders come rushing to assist him. They probably notice he's not responsive. He doesn't have a pulse, and you could see the efforts by the bystanders to initiate CPR. And there is a part of the video also where there seemed to be an external defibrillator being applied to his chest, and it looks like he did receive a shock to his chest from the way his body moved. This is something that we all could learn from, because we never know in what situation, in what circumstance we could have situations like that at home, in the gym, in a public place, in a theater, on the street. So remember the advice that we have discussed here in Dr. Hart channel. Stay calm, call for help, shout out to see if there is any external defibrillator around, so that people that are coming in trying to help quickly scramble around to see if they can find something like that. And if you notice the patient is unresponsive, doesn't have a pulse, initiate CPR by doing that cardiac massage, which is chest compressions at a tune of about 100 beats per minute. That way you could sustain life until other people are calling 911 and are scrambling around trying to find an external defibrillator. Those steps right there could be life-saving, and from what I can see, these bystanders knew what to do and saved this patient's life.